This is Unit 8, Anti-Infective and Antibiotic Agents. So these are your objectives, and these are your reading assignments. As always, feel free to read them. That being said, for the most part, it should be enough to follow the outline and read, as well as listen or watch the recorded lectures. All right, so before we start talking about the different therapies, the different antibiotics, let's just review some infection cues, or these are the signs and symptoms of infection. Now, we're not going to cover everything, but we're just going to cover the common signs and symptoms of infection. So, upon physical assessment, so when we're examining our patient, usually if there's an infected area of the body or infected site, there tends to be some warmth, so it's warm to touch. There's some redness, swelling or edema. Occasionally, there may be some drainage or pus formation. Some patients may come in with fever or elevated temperature, as well as elevated heart rate or tachycardia. And as I mentioned before, there could be many different symptoms depending on the location and type of infection, but these are your more common assessment findings or cues when a patient has an infection going on. Now, if we're looking at the laboratory data, or the labs, you may tend to see increase in WBCs. Now, it is not uncommon though to see a decrease in WBC, although it's more common to see an increased WBC. So, some patients, when their immune system is too overwhelmed, their reaction to an infection is actually the opposite. It may drop their WBCs down. So, but for these purposes, generally speaking, when there's an infection, the WBCs are up. Other lab results can include culture, so we're going to talk about it even more, but basically this is a test where they can actually identify the microorganism that's causing the infection. All right, let's talk specifically about the anti-infective agents or antibiotic agents. So oftentimes when we're talking about this, you may hear this terminology: gram stain, culture, and sensitivity. So what is the difference? What do they mean? And why do we even do this test? How is it benefiting us in treating the patients with an infection? And so let's start with gram stain. So gram stain is a test that allows us to classify the bacteria between gram positive and gram negative. So during the test, they add a dye or a stain, and it turns the bacteria different colors. And depending on what color it turns into, it tells us if it's a gram positive or gram negative. And so for gram positive microorganisms or bacteria, these organisms turn the dye or the stain into blue or purple, and this usually means that the bacteria has a thick cell wall, and versus a gram negative. So for gram negative bacteria, they appear pink or reddish after a gram stain, and these tend to have thin walls. That being said, they have more lipid content and they have two membranes. So gram negative bacteria, although their membranes are although their walls are thinner, they're actually more difficult to treat because of their two membranes. It's harder to penetrate the two membranes compared to gram positive organisms. All right, on the other hand, a culture is actually a test that's more specific in identifying the specific bacteria or organism that's causing the infection. So this is done by allowing it to grow or multiply, usually in a dish, in an agar, or sometimes in a liquid substance. So this just allows the bacteria to grow. And so by doing that, it will allow us to identify what organism is causing the infection. So this is more specific. Now, sensitivity, on the other hand, it's also called susceptibility test. So this is a test where we test the bacteria against some antibiotics to see if they are sensitive to it. So this helps us in determining the appropriate antibiotic treatment. So this helps identify which agent or antibiotic is active against some microorganisms. Now, you may also hear the words prophylactic, empiric, or indirect or definitive therapy. So prophylactic therapy is basically an antibiotic treatment prior to exposure to infectious organisms. So this is basically preventative. So prophylaxis or prophylactic therapy is preventative treatment. On the other hand, sometimes we use the terminology empiric. So empiric therapy is basically when we use the antibiotic treatment based on the nurse practitioner, the doctor, or the provider's judgment, based on the most common pathogen or organism that's likely causing that infection. So they have sort of an idea of what it could be, but they are not 100% sure. Now, the main difference, prophylactic, there's no infection. Empiric, they know that there's an infection. They're just not 100% or not sure that that organism is what they're actually treating. All right, on the other hand, direct or definitive therapy is when they use antibiotic to treat a known infection or microorganism. So this is usually because they already have their blood culture results. So they know specifically what organism they are treating. So the difference is, right, prophylaxis is just preventative. Empiric, there is an infection, but they're just assuming that it's a certain bacteria, although they're still not 100% sure. It's just based on their own judgment. Now, in direct definitive, they're treating an infection and they already know what kind of infection, what microorganism is causing that infection. All right, another term that you want to be familiarized with is selective toxicity. So this is really how antibiotics work typically, right? So selective toxicity is basically when chemicals or substances will produce injury to one kind of living matter without harming another form of life. So again, this is really how antibiotics will work. So antibiotics will kill the bacteria. Meanwhile, it does not kill the patient, right? Or the person. So that's selective toxicity for you. Now, allergy or allergies, as you guys know, you may be more familiar with this, right? Allergy is an immune system response to a foreign substance that's not typically harmful to your body. And many patients tend to develop allergies to certain antibiotics. So that's why you need to know allergy. Organ function, it is something that you want to consider when giving antibiotics. So always take in consideration your two main organs that can affect the effectiveness of the treatment and also the toxicity or potential for toxicity when using certain antibiotics. So the two organs that you want to consider are your liver and kidneys because they're responsible for metabolizing the antibiotics and at the same time excreting the antibiotics. So if either of organs are not working well, or maybe both are not working well, then we have a potential of having less effect and more toxicity when it comes to these medications. All right, another term that you may want to learn is colonization. So some people think that colonization is the same as infection. Well, in fact, it's not the same. So colonization is really just the presence of bacteria on a body's surface, so like the skin, mouth, intestines, airway. So basically, they're just there, but it doesn't really mean that they have an infection. So this is the presence of bacteria without causing disease in the person. Two terms that you may want to hear when it comes to the effect of antibiotic is bactericidal and bacteriostatic. So bactericidal antibiotics will kill the bacteria. So those are bactericidal. Bacteriostatic, it doesn't actually kill the bacteria, rather it just prevents it from growing and multiplying. Next up, we're going to talk about are broad spectrum antibiotics or drugs and then narrow spectrum drugs or antibiotics. So let's first start talking about broad spectrum drugs. So broad spectrum drugs are basically effective against a wide range or larger group types and strains of bacteria. So it covers either gram-negative and gram-positive. So this type of treatment is very effective when we still don't know exactly what's causing the infection. So this is commonly given in severe infection and they can't really wait until they get the culture results. And so they just start treating patients with broad spectrum antibiotics or drugs. Now, on the other hand, we have narrow spectrum drugs. So these are basically antibiotic treatment that's effective against very limited or very specific types of bacteria. So it tends to be that it's usually either just for gram-positive microorganisms or just for gram-negative microorganisms. And this type of treatment or antibiotic therapy is more appropriate once they already narrowed down, right, their options, and they narrowed down the specific type of microorganism that's causing the infection. So typically they already have at least a gram stain result, and occasionally they may already have the culture result. So therefore they can just narrow down the antibiotic, so they don't have to give broad spectrum antibiotic. Especially when broad spectrum antibiotic, we may be increasing the risk of the patient in developing some sort of bacterial resistance or superinfection. Anyhow, so antimicrobial classification. So there are terms that we use when it comes to antibiotics or antimicrobial. So the first three are interchangeable. They basically mean the same thing with just mild difference. You really don't have to know the difference. Know that these are interchangeable, and it basically means that these are substances or drugs against microorganism or bacteria. So antibiotic, antimicrobial, and antibacterial are used interchangeably. So again, these are substances or drugs against bacteria or microorganisms. Now, antifungal is basically a term that we use for substances or drugs against fungus and yeast. On the other hand, we have antiviral, so very specific, right? Antiviral are substances or drugs against viruses. Something that you may hear when we're treating a patient with some antibiotic is bacterial resistance. So bacterial resistance is really, it happens when bacteria is difficult to treat with regular antibiotics. So bacteria is resistant to treatment. So this image right here kind of demonstrates how antibiotic or bacterial resistance happens. So step one, there is a population of bacteria, and then there may be one that's mutated and it becomes resistant to antibiotics. So what happens is we give the patient some antibiotics and it kills all the other susceptible bacteria except for the resistant ones, right? Because it's resistant to that bacteria. It's really unable to penetrate that organism. And so then what happens is that antibiotic resistant or bacterial resistant or a bacteria that's resistant to antibiotic, it multiplies, right? And it forms a different population, a new population with all resistant microorganisms. And so that unfortunately, antibiotic resistant bacteria can also transfer their mutation to other types of bacteria. So that makes this type of bacteria difficult to eradicate, and it causes super infections. All right, so adverse reaction from antibiotic therapy can include superinfection and secondary infection. And so superinfection is really, it happens secondary to the presence of bacteria that's resistant to antibiotics. So again, superinfection is a type of infection that usually happens after an initial infection happening, but what happens is this type of infection is more resistant and difficult to treat. Now, secondary infection is an infection after an original infection, and it doesn't necessarily have to be the same microorganism, except it's more resistant. So secondary infection, a more common secondary infection is maybe a patient had the flu, and then after having the flu, once the flu was better, they develop a secondary infection with a bacterial infection. So it's a different type of infection, but it's usually a result of the weakened immune system of the patient, not necessarily because of some sort of bacterial resistance. All right, patient education. When we're giving antibiotic, it is very important to educate our patient regarding antibiotics. So number one, we need to educate them for the appropriate use of antimicrobial agents. Example, if they have maybe the flu or a viral infection, it is really not appropriate to take antibiotics for it or go to their provider to ask for antibiotics. Now, also, they need to be familiar with the guidelines for how to take the drug, making sure that they're taking it as prescribed to prevent development of bacterial resistance. Now, the course of treatment, meaning they have to complete the therapy even though they're already feeling better. So if the order or the prescription says take the medications for 7 days, even though they're feeling better on day 4, they still need to make sure that they complete the treatment, because again, this will prevent the development of a secondary infection, mainly a superinfection, due to a bacterial resistance. Now, in addition, we need to make sure that we're educating them regarding potential side effects and drug interactions, especially depending on what type of antibiotic they're receiving. Now, these are general principles for all antimicrobial medications or antibiotics. So please remember all of this. Now, put an X next to it, highlight it. This will be on a test. All right, so indications for antimicrobial therapy usually depends on the choice of the agent, right? Depends on the bacteria or the infection. Side effects, common side effects, generally speaking, of antibiotic are GI or gastrointestinal side effects. So common among all agents. So usually causes nausea, vomiting, diarrhea, stomach, and abdominal cramping. Now, precautions. Antibiotics can decrease the effectiveness of oral contraceptives in general. So this is especially important to tell our patients who are taking contraceptive agents. And then all have the potential of causing a secondary infection. Meaning, right, when the patients are on it, they may develop a different type of infection afterwards. The most common one is after antibiotic therapy. The patient may develop a yeast infection. Now, contraindications, sensitivity and allergy to any drug in the class, obviously. So if they're already allergic to one type of penicillin, then they shouldn't be receiving another type from that same form class, because there tends to be a basically allergy to all or the whole class as a whole. Nursing actions, making sure that we're getting an accurate allergy list because of allergic reactions, as we discussed. And then follow the WBC trend to see if maybe the treatment is effective and the infection is getting better, or the other way around, maybe the treatment is not effective. So please, we need to follow the WBC, as well as look at our signs and symptoms to see if, again, the patient is responding to treatment. Now, it is also important to follow the culture and sensitivity. So as we mentioned earlier, right, culture will tell specifically what microbe or bacteria is causing the infection, while sensitivity, it allows us to determine which antibiotic is effective against that type of infection. So by making sure that we're looking at this, it helps us treat the infection appropriately with the correct antimicrobial agent. Beta-lactam antibiotics. So when you hear this, before you can fully understand what we're talking about, we need to understand what a beta-lactam ring is and what is beta-lactamase. So beta-lactam ring is really a ring that's in certain types of antibiotics. So these beta-lactam antibiotics are commonly used antibiotics. They're named because of the beta-lactam ring that is part of their chemical structure. So that's part of the structure of the antibiotic. So beta-lactam ring, we're talking about the antibiotic. Now, beta-lactamase, it's an enzyme produced by some bacterial strains. So this can inactivate some of the antibiotic molecules, right? Namely, the beta-lactam ring. So it can actually help dissolve or penetrate that beta-lactam ring, especially in penicillin antibiotics. So this causes some bacterial resistance. So again, this can break down the beta-lactam ring in beta-lactam antibiotics. So when we're talking about the beta-lactam ring, we're talking about the antibiotic. Beta-lactamase is really an enzyme produced by the bacteria. All right, knowing what we know now, right? Now that we understand what beta-lactam ring is, or beta-lactam antibiotics, and what beta-lactamase enzyme is, let's look at the beta-lactam antibiotics. So beta-lactam antibiotics, again, this have the beta-lactam rings. So beta-lactam antibiotics include penicillins, cephalosporins, carbapenems, and monobactams. Now, we know that some bacteria or microorganisms have beta-lactamase. And so because of that, right, the pharmaceutical companies develop beta-lactamase inhibitors. So these are antibiotics that actually inhibit the activity of beta-lactamase. So this prevents this bacteria from breaking down that beta-lactam ring. So it acts against this enzyme. So what tends to happen is they combine beta-lactam antibiotics with beta-lactamase inhibitors. So beta-lactamase inhibitors are also types of antibiotics. So again, these are antibiotics, right, that will prevent or stop the effect of beta-lactamase enzyme from the bacteria to prevent the breakdown of the beta-lactam ring in beta-lactam antibiotics. So beta-lactamase inhibitors include clavulanate and sulbactam as well as tazobactam. So please remember this, memorize these antibiotics, and understand the differences between beta-lactam ring, beta-lactamase, beta-lactam antibiotics, and beta-lactamase inhibitors.